Hi, my name is Anita Saravanan. I'm an assistant professor at Northern Illinois University. I'm going to share with you today a secondary data analysis from my dissertation findings, which was focused on looking at behavioral symptoms in chronic low back pain. Before I start, I want to share with you the reason I did this secondary analysis is because I'm really interested in learning about wearable devices, including smartwatches and Apple devices, which you probably have heard that they are possibly going to be able to detect O2 levels, right, oxygen levels, using these iPhones. So with that in mind, I would like to continue to present this poster to share with you some important findings here. For my dissertation, when I did look at sleep, one of the symptoms of chronic low back pain as part of the behavioral symptom profile. We did use three questionnaires. One was the sleep diary, the other was the PSQI, and the last one was the brief pain inventory to measure pain. So the findings, revealed that there were significant differences between behavioral symptom groups. So we identified two behavioral symptom groups, one with the high behavioral symptom and the other with the low behavioral symptom. So in the process of measuring sleep with using an actigraphy for a small sample size, we were able to, from this data, identify the importance of using such devices and maybe helping in the future to look at different types of wearable devices and technologies, not only to manage symptoms including sleep and pain, but also to help patients self-manage their symptoms, to be able to track their extent of sleep, and to be able to come up with some interventions to self-manage their condition, not only sleep, but overall with chronic low back pain. So with that being said, the main aim of the study was to determine if there was any association between the pain experiences in chronic low back pain and sleep disturbance itself, and then to see if there are correlations between subjective and objective sleep indicators. So the subjective indicators are the sleep diary and the PSQI, the sleep questionnaire, and the objective sleep indicator would be the actigraphy. So we looked at various parameters inside these three measures or tools, if you want to call it, to see if there were any significant correlation, particularly in terms of sleep disturbances. So overall, the methods, there were about 69 participants and their mean age was 56 and mostly female Caucasian. And the measures of sleep included not only sleep disturbance, but also quality through the PSQI and sleep diary. And the brief pain inventory measured both pain interference and pain quality. However, because the actigraph watches are expensive and due to lack of funding, we just used 13 watches to track sleep over 6 nights. And also for the sleep disturbance, using the PSQI, it records for a month, but for the sleep diary also measured for 6 nights. So 6 nights for sleep diary and 6 nights for the actigraph was used, and then the PSQI measured for a month. That's how the PSQI usually does. So important to note from the results, there are many things that you see here, many variables in the correlations. We did Pearson our correlation to see the significant findings. So as far as pain and sleep, if you look at this table here, pain severity, pain interference, there is significant correlation between sleep quality and feeling rested and sleep disturbance across the three measures, including actigraphy. So as already established in various studies, there is conclusive evidence that pain interferes with sleep and sleep could interfere with pain. There's bidirectional relationship, right? So we kind of confirmed that that's true in this population too. So particularly, it was also important to see that 85% of the total sample had mean PSQI above the cutoff score. So the PSQI levels measures indicated that this group had significantly higher pain itself, along with sleep problems. So the focus here for this poster, because it's a small session, I would like to really bring your attention to the subgroup analysis of the risk actigraphy, the table that you see here. So here you can see that the sleep diary has quality, number of awakenings, and feeling rested. So those correlated those correlated with the PSQI sleep disturbances significantly. All of these correlated with the sleep diary. So we know that the two subjective measures correlated in this sample. And these two, the VASO, or the wake after sleep onset, and the sleep efficiency, there was correlation between this quality of sleep and the sleep diary. So the two measures, the sleep efficacy and the wake after sleep onset, this for sure will indicate sleep disturbances was correlating with the sleep diary. So if we take a step back and look, even though the sample size was small, it is only 69, it looks like 6 nights sleep quality correlates with the actigraphy, which was 6 nights as well in terms of sleep disturbances. There are some studies that show that even the polysomnography, the gold standard for measuring sleep, and the actigraphy might not reveal the exact the number of hours slept or the number of sleep disturbances. Studies show that participants usually underestimate their lack of sleep. Most of the times when they, report sleep disturbances, they are not accurately reported as compared to what they show in the diary. So that brings the whole question of, even if someone feels their objective sleep measure like the polysomnography or the VASO are reflecting, objectively the sleep, but one might wake up feeling not as rested, even though these measures could be telling that they did get enough sleep. So again, brings us to the question, the nature of sleep being so subjective, right? Hence, there's always need for further devices or advanced technology to correlate what the patient says they feel or when they feel rested subjectively, along with objective measures, so I think we're at an exciting time where we could look at wearable devices to see if there's better means to measure sleep and correlate that with some app or something where we could look at their symptoms, including pain. So this is a little graph about, it's a figure showing that the pain experiences, particularly pain severity, increased as the sleep disturbances was increased in this sample. So overall, the findings demonstrate that chronic low back pain patients who reported greater sleep experienced greater pain severity and greater interferences. And actigraphy also added more insight into what is recorded in the subjective versus the objective. And to conclude, for nursing, there's a lot of research to be done in this area, not only identifying specifically which measures might be the most suitable for measuring sleep in chronic low back pain, but also to understand which parameters to look at. Is the sleep disturbance itself the best solution for this population? Further, we need robust studies to see if there are other smartwatches or other devices that could be used to measure sleep, and then how it can influence the pain and other symptoms as well. With that said, I would like to thank you for the time for listening. I think there's a FAQ area where you could ask if you have any questions.